as I've mentioned before in a number of podcasts, don't do a 1-year course and be under the assumption I can treat all cases. Good morning, everybody. Well, I don't know when you're listening. It might be afternoon, might be middle of the night. Hello, anyway. My name's Pav Kara. Welcome back to the next episode of the Dental Implant podcast. So thank you for tuning in. This episode, I've got my notes here again. This episode, there's somebody who said, look, Pav, can you go over the pros and cons of adding dental implants to your practice? So I thought actually that'd be quite a good one to do. But what I thought I'd do is, in addition to just adding it to your skill set and to your practice, is go over what happens when you start to expand your skills, because you'll find that you're going to come across the same hurdles. So let's get started, okay? So what's the upside to adding dental implants to your practice? Well, it's a very highly desired treatment by very many people. You know, let's face it, when you've got a tooth missing, there's one of 4 options. We all know these. We can leave it as a space, have a denture made, have a bridge made, or look at implants. That's it. Those are the only viable options available. And when you speak to patients like, well, I don't want to have a space, I certainly don't want anything removable in my mouth, and looking at the data nowadays is, you know, should we really be doing that many bridges when, you know, implants are so predictable? Because the way that I explain it to my patients is that look, it's, you know, your teeth either side don't need any restorations, or even if they have got crowns, quite often it might be compromised. Is if you're bridging across that gap, well, what happens when something happens to that bridge? Because a 1-tooth problem is going to become a 3-tooth problem, effectively magnifying your problems long term. So in that context, a vast majority of patients, when they want a fixed replacement, they do actually want an implant. So that's the upside of adding it to your practice, in that, you know, is a lot of patients will want to have it done. Okay, let's talk about another upside. You can obviously increase your hourly rate. You know, you can generate more income from this. Now, this is a double-edged sword, and a sword of Damocles as well. And I'll circle back to that in a minute. But certainly, one of the upsides is you can generate more income over per hour than what you would do doing kind of like general work. Okay. Now, let's look at another upside. And I'm going to say this one with, I'll give it with a little bit of a pinch of salt. Potential referrals from other dentists, okay? Yes, of course, that's true. If you become proficient at implants and you start to do a lot of them, you may find that dentist will start to refer to you, okay? Now, what I will also say in the same breath is, come on, guys, you know what dentists like. They don't want to send you business, you know. So it's to generate the type of practice where you are actually accepting referrals. What generally tends to happen is it happens over a very long time. And you have to be very, very committed to delivering the best outcomes possible for patients, okay? Now, I'm not trying to put anybody off, but if you're early in your implant career, you've got a long way to go before you start proving yourselves to your peers and your colleagues that you are proficient at this, and only then will they start to send you cases, and they may actually start to send you cases that they themselves don't want to do because it's too complicated for them. So not only does it take time to do, but you generally find that the work you get sent is of the more complex nature. Again, I'm not trying to put anybody off. Anybody can attain the correct training, the correct skills in order to be able to help these patients. But as I've mentioned before in a number of podcasts, don't do a 1-year course and be under the assumption I can treat all cases. I've discussed previously with Fran with regards to mentoring. I mentor other dentists. I am being mentored myself. It's a continual learning curve. So again, please, I'm not trying to put anybody off, but I'm trying to give you realistic expectations with regards to what to expect. Now, what I will say is if you start doing really good treatment for your patients, that is actually when they will refer other friends and colleagues to you. So a big source of referrals is actually your patient base. Yeah, just bear that in mind, okay? So the next upside, increased patient satisfaction. Now, the reason why I say this, again, is really quite simple, is if a patient has been walking around with a denture in their mouth for months or years, you'll generally find the vast majority of patients will absolutely hate it. They really don't like it whatsoever. Or the flip side of the coin is patients who are about to have a tooth removed and don't want to have a denture, is they will do anything to have a fixed tooth replacement. And generally what you find is with the right patient, those who want a fixed solution, those who don't want to have dentures, when the treatment goes well, they're generally very, very happy with the treatment, and they just love it because they like the fact that they haven't had to prepare the adjacent teeth either side, and the fact that once it's in, they can brush it, they can floss around it just as they would with their normal tooth. So it does increase patient satisfaction. Okay. This is another good one, okay? And again, listen to the words I'm going to use very carefully. When things go right, patients will rave about you. Now, what do you think the important words are there? When things go right. Absolutely, okay? Anybody who sits there or stands there and turns around and says to you that 100% of their cases are perfect, that they never have problems, they are either doing 1 or 2 cases per year and cherry selecting the easiest of the cases, or they are lying to you. That's it. There is no in between, okay? I get failures. It's the nature of what we do. Sometimes it's a biological failure. Sometimes it's an aesthetic failure. Sometimes it's a patient management failure. But you know what? That's just the nature of what we do. Dental implants are no different to any other aspect of dentistry, okay? If you went to an endodontist and turned around and said to him, is your success rate 100%? Even a specialist endodontist won't say yes to you, okay? We've all done those restorations where we put them in and, patient comes back a week later and another part of the tooth's fractured, or the restoration's fractured, or, that's the nature of dealing with patients. So what I would say is don't beat yourself up about it, but understand that when you take the correct steps and you get a really nice result for these patients, they will absolutely rave about you. 100% they will, okay? And it actually helps develop your business in such that you end up with a raving fan who will they'll speak to their friends and their family about you. Okay. Now let's start to look at some of the downsides to introducing implants to your practice. And when I talk about this, please also understand that I'm also referencing increasing your skill set. Okay. So let's say you've been placing simple implants and all of a sudden you decide, right, I want to start doing sinus work. This applies straight to that as well. There is always a learning curve. Look at the Dunning-Kruger effect, okay? And what will quite often end up happening is and this happened to me. I'm not saying that I'm immune to this. 100% this happened to me. But this is one of the reasons I'm so keen on mentoring is when you first start doing a new skill, let's say, for example, sinus work, it might be block grafting, it might be Kuri plate, it might be whatever it is, it might be full arches, is you go on a course, you invest your time, you invest your money, you invest in the equipment, but you don't have the muscle memory yet, okay? And when you start doing these cases, you'll realize that you understand the theory aspect of it, but the technical aspects takes time to learn. And this is where mentoring is really important. And what happens is the more complex that your treatment becomes, the more you need a mentor, okay? Do I rip sinus membranes? Yeah, absolutely I do. Because you know what? That's the nature of dealing with sinuses. You have some patients where they've got really thin sinus membranes. It's as tight as a snare drum. So as soon as you touch it, it will rip. And they've got these little spicules of bone projecting into the sinus. And to work around that is sometimes very, very difficult. And then you have the opposite end of the scale where you get certain sinuses where you can almost do whatever you want, and everything is fine. It's, you couldn't rip the patient's lining if you tried. So there is this whole range of patients that you need to be able to help. So again, circling back to what I was saying before, and I did say I would circle back to this, that increased hourly rate. Do you think it happens right off the bat? Do you think that you go on a course on a Friday, Saturday, a Monday morning, you can increase your hourly rate? Okay. No. You know what's going to happen to start with? Your hourly rate's going to drop quite significantly and for probably a decent amount of time as well. And if you add a mentor into the mix, it's going to drop even further because you're paying your mentor. Okay. Now, why do I say this? Is because it takes time to learn these skills. And when the very first implant I placed by myself, okay, I booked out 3 hours in the diary. 3 hours to place a single implant in a healed site. You know what? It took me 2 hours, 45 minutes. If I had that same patient come in today, I'd probably get it done in 10 minutes. Now, I did not develop that skill set from going from nearly 3 hours to under 10 minutes. I'm not saying all my implants take 10 minutes. Sometimes they take an hour and a half. They just do, okay? But what I'm trying to express to you is that did not happen overnight. I've been doing this for the best part of a decade, more than a decade, okay? And when you start to do more, that's when you start to get the muscle memory. So your hourly rate will increase long term as long as you have the correct exposure, but in the short term, it's going to decrease. Don't be put off by that. This is very much a game of passion, okay? If you want to stick to the simple stuff, and I've said this before, fine, stick to the simple stuff. Get somebody else to come in and help you or refer out the complex stuff. That's actually one of the best ways, to increase your hourly rate, okay? But if, like me, you're doing it for passion because you love it and you want to be able to help every single patient who walks in through that door that I'm capable of helping. So my boundaries are going to stop at MaxFax because obviously I'm not MaxFax qualified. But anything up to that point that I can learn, I will learn. I will become proficient at it. But it's costing me time, it's costing me money, it's costing me fees in mentoring. So, this is what the reason why I say this is because whatever I say to you applies to me as well. I am no different. I don't have some sort of genie in a lamp who can bypass all of this. And again, I've mentioned before that I'm very fortunate that Greg Boyes-Varley will be joining the team at Evo Dental. And I will be having my zygomatic implant training with him. Greg's one of the most experienced zygomatic guys, if not the most experienced zygomatic surgeon on the planet. And, so it's choosing your mentors, and he loves to teach. He's absolutely top guy, okay? So, moving on to more of the downsides. Let me lump these together because they all start with the same word. Expensive to have your training, okay? It's expensive to buy the equipment, and mentoring is expensive as well. So expense. You've got to do a course, okay? Whatever course you want to do. Let's say, for example, let's go back to sinus lifting because I gave that as an example before. Three and a half grand on a sinus lifting course, okay? You've then got to buy a sinus lifting kit. So there's another couple of grand, easy, okay? You've then got to be mentored for at least 20 cases, if not 50, to start to learn, and that's got to be over a relatively short time frame so you can start to build up the muscle memory. If you're doing 20 cases over a 20-year period, you really think that you're going to learn how to deal with sinuses? No, it needs to be quite quick, okay? So, and I've done a whole podcast on this before as well. Don't let me put you off. If you want to do it, absolutely do it. Just understand when you're getting into it, it's a much bigger game than what you think that it is, okay? But it is fantastic to do. Now, when I go into sinuses, it's like, oh, great, I'm going into sinus today. I'm really going to help this patient, okay? And there is the next downside, there is a learning curve to everything. And you're not going to get it right every single time. And again, this is why mentoring is really, really important. So you need to understand that whatever you learn in your course, you are not going to go back to your practice the following week and immediately start implementing it. Now, the proviso to that is if you're already a very experienced surgeon, then obviously you can implement things a lot better because you obviously understand the surgical aspects significantly better, okay? So It's a journey, and I keep saying this. It's a long journey, and I'm only partway through mine, and you got to keep going. Have to keep going. Absolutely. Okay? So another downside, but, again, this applies to every aspect of what we do, is identifying the good evidence from the bad evidence, okay? Don't just have a rep come in to see you, whether it's for a dental material or whether it's for an implant. Turn around and say, ooh, we've got a new surface. Ooh, I've got a new bone graft material. Ooh, I've got this. Ooh, I've got that. And it will reduce your healing period. You won't get any failures. You won't have this. You will do this. You will do. Best thing to say to them, give me the evidence. I want to look at it. And I will guarantee you 9 times out of 10, the evidence you get will either be non-existent. They'll say, oh, yeah, you know what, that's fine. I'll get back to you. Or it'll be completely nonsense. You cannot just read abstracts. You have to critically appraise papers. And when you start critically appraising papers, first thing that you'll notice is every single paper out there is flawed, every single one. Some are more flawed than others. But when you really start to go through everything with a fine comb, what you will find is that I'd say probably 90 to 95% of papers out there are completely useless. And I mean, it's just like, and what ends up happening is a lot of reps just work off the back of that. So I've got no problems with reps coming to me and saying to me, Pav, we want you to look at this, want you to look at that. Bring the evidence with you and understand that I will 100% look at it critically. And if it's a load of nonsense, I'll tell you it's a load of nonsense as well, okay? So you need to have the skills to be able to disseminate that. Otherwise, you're going to end up buying equipment that you don't need or doesn't work, or it just becomes endless. It takes a long time to develop well-rounded skill sets. It does, okay? I am probably starting to hone my skill set more, and as I said, I'm 10 years into my journey. Now, what you need to look at is you need to look at your demographics, okay? You want to implement implants, but you're in an area where your patients can't afford implants and none of them want implants. You're better off learning a different skill set where you can help your patients further or move or look at entering into multiple practices where you can do this type of stuff. So you need to understand that once you get your hands wet, remember 10,000 hours is what they say it takes to develop a skill set. So if you develop one skill set, then you add another one, then you've got another 10,000 hours of training to do before you become proficient at it. So you really have to have that commitment long term. If you've got that commitment, then it's fine. It's not a problem. And I know dentists who have started with implants, not gone as smoothly as what they wanted it to, and they've kind of like thrown in the towel. And there are no other colleagues where they are hell-bent and it's just like nothing is going to stop them, okay? So you need to understand what fits in with your diary. So I see a lot of dentists going practice to practice, placing implants. And again, this is something that I spoke about with Farhan Ahmed, is the upside to that is you do what you love, okay? The downside of that is it takes you away from your family. So when I was speaking to Farhan, he said that he hadn't been home for 3 days. I couldn't do that. I've got my family time is too precious to me, and it's not something that I want to do. If you're prepared to wake up at 3-4 o'clock in the morning, drive 200-300 miles to do a surgical day, maybe even spend a night in the hotel. I used to do this. And then come home and not see your family for maybe a day, 2 days, 3 days. If you think you can live with that, that's fine. Or if you're in an area and you're fortunate where you don't have to do that, but you can still get the surgical exposure, absolutely go for it. But understand that that is a downside, that it does take time to develop your skill set. But as I said before, don't let anybody put you off, but you need a realistic expectation going into it, okay? What's another downside? Okay, mistakes are very expensive. Okay, so let me give you an example. So let's say you do a filling for a patient at the front of the mouth. The patient's back the following week and it chips. Well, fine, put the patient in for another 20 minutes and you redo it. It's more of a nuisance than anything else. Okay, now if you start doing this type of work, you will have failures with implants. Now, it's bad enough when you've got a single implant failure, okay? And it will happen, it happens to everybody. When you've got a single implant failure, that's a major pain in the backside. But imagine what happens as the complexity of treatment starts to go up. Okay, I've had a couple of full arch cases from a few years ago that didn't go according to plan. When you've placed multiple implants and you've already paid for the definitive bridges and it's not gone according to plan, do you think the patient's going to pay you again when it doesn't last more than a year? No, that's on you to sort. Can you imagine how much time it takes to redo a full arch case at your own expense? So this is what I'm saying is having a good mentor will allow you to bypass a lot of that. That's why I keep going on about it. This is one of the reasons why, whilst I've got the theoretical knowledge for zygomatic implants, I've assisted with a fair few, I've done a fair few under mentoring, is I am not going to start embarking on that until I've got my mentor sat over my shoulder, because I don't want to do something that's unfavorable for the patients. But additionally, I don't want to do something that's then I've got to try to rectify. That's going to take me a vast amount of time. I need my mentor to be able to train me and say to me, you know what, Pav, this is how you want to do it, because if you do it this way, then this is going to happen. If you do, no, don't do it that way. So what you're doing for a mentor is you're buying their experience. You're buying the experience of their mistakes. They are saying to you, this is what doesn't work, and it doesn't work because I've done it, but this is what does work. That's why, one way or another, you're going to pay. Okay, one way or another, you're going to pay. You either pay through mistakes and redos, or you pay a mentor. Okay, guess which one is probably better? Yeah, absolutely, mentoring. This is why I keep going on about it. Okay, so let me make sure that I've covered everything. Many techniques, this is again another downside, many techniques are actually very difficult to master. Okay, they're easy to convey, but they take a long time to master, partly because you need that exposure to them, but partly because they're actually very fiddly and they are very technique sensitive. Let me give you an example. Bone grafting. Okay, now a lot of you may sit there and think to yourself, well, what's with bone grafting? Just slap a little bit of bios on there and a little bit of membrane and you're good. True regeneration is far more complex than that. And I'm talking about regenerating bone properly, regenerating gum tissue properly, and creating an outcome which is very predictable for your patients. Okay? Don't be a one-trick pony. Don't go on a course and say, oh, you know what? BioOS will sort everything, or this material will sort everything. It very much depends on the defect. It very much depends on the patient. So you need several skill sets up your sleeve to be able to help these patients. Now, you imagine learning several skill sets, buying the equipment for several skill sets, and being exposed to enough for several skill sets in order for you to become a master at this. So this is what I'm saying is mastery takes time. Okay, if you're in this because you want to increase your profits, but you want to, you still want decent family time, you want less headache, my advice is really simple. Actually, don't do the complex stuff. Do the easier stuff, send the complex stuff out, have somebody come to your practice to do the complex stuff. You can still assist with it, but what will then happen is you'll get the good hourly rate from doing the simpler stuff, but you're giving the headache of the complex stuff to somebody else. I've had it before where I've done a quadrant graft. Part of it takes, part of it doesn't take, or all of it doesn't take. What do you do then? And this is why I'm expressing to you is it takes time. Is anything can fail in dentistry, and implants are no different. You can have biological failures, aesthetic failures, you can have mechanical failures. But okay, now that I've gone through the doom and gloom, let me finish on a positive note. Anybody absolutely can learn this skill set. It takes time, it takes patience, and it takes investment, okay? And it is incredibly satisfying to do as well. So, for example, now that I've been at Evo nearly a year, we do my average day, 4 days a week is a dual arch, because I'm here 4 days a week, so I generally do surgery 3 to 4 days a week. It's normally 4 days a week. And having that immersion has vastly improved my skill set when it comes to full arches. And I wouldn't, retrospectively, looking at what I was doing externally from here, it's a completely different ballgame. And that, again, is partly because of the mentoring that I've had. It's the immersion. It's being exposed to enough of it as well. Again, if I was doing 10, 12 arches a year. It's not enough. It's not enough. Okay. So I hope that this has been useful for you. Obviously, there will be more podcasts coming. If there's anything in particular that you want to know about, please let me know. And I hope that I've gone through the pros and cons of not only introducing implants into your practice, but what happens when you expand your skill set as well. So thank you very much for tuning in. Please do share my podcast with your friends. Get in touch if you want. And I'll see you guys later. Bye.